Mr. Huelskamp for 5 minutes.
Thank you, Mr. Chairman. I appreciate you providing an opportunity for this hearing. And I must say, I have a lot of words to describe my feelings, and embarrassed by the actions or lack thereof by the VA might be one of those. Shocked, surprised. I guess I'll probably be even more surprised by later testimony. But if I understand correctly, one of the things you did mention that that there was a violation or personal emails of the Secretary and high-level staff were compromised. And can you describe that a little bit further?
Yeah, my understanding is that when the domain controllers got compromised, they got access to the senior leadership emails accounts. And there is information that indicates that those emails were actually exported outside the VA network. The value of them is unknown. What they did with those emails is unknown. But whenever you compromise a domain controller, essentially you own the enterprise. That's the seriousness of it.
Yeah, and I appreciate that. You own the access to 20 million records plus that of their dependents. What was the VA response when you brought that to their attention?
It wasn't formally communicated to me. I heard it in a meeting that was discussed between the NSOC, and they probably were unaware I was listening in. But that is just what I heard just by observing some of these meetings and describing these events.
And this is very shocking, Mr. Chairman. I know we have a letter in front of us from a very high-ranking official at the VA that says, quote, VA security posture was never at risk. Was never at risk. And that's a quote from a high-ranking official. And I would guess that perhaps they used email to put this together. Can you imagine the thought that the folks that were hacking the system were actually reading this email as they were exporting 20 million private records? And you indicated we do have evidence potentially of external state-sponsored espionage that might be occurring through the VA. One of you had indicated that was a possibility?
That's my understanding.
Okay. And did you bring this to the VA's attention, and what was their response?
We haven't, with the FSMA work, we haven't specifically addressed that issue. We do get into incident handling and monitoring, and we identify every year there are network connections that aren't being monitored by VA. So the risk is that you could have systems compromised, data being transmitted externally, and VA could be unaware of it.
They could be unaware that the information is actually leaving, and if asked, they could potentially, even under oath, say, we know of no such transmission, which, if I understand correctly, might absolutely be true, and would suggest, obviously, when you've given up control of the system, like you indicated, you would have absolutely no idea of the threat then?
That's correct.
Sir, one of the things that we do as part of our oversight, and we try to do a lot and gain an understanding of what is happening in VA environment, and then we send information to our contractor who is doing the actual FSMA assessment to put the right steps in place to do full evaluations to truly understand the risk. That's all happening as part of the process.
Yeah, and I appreciate your work. I mean, you have a very difficult task of identifying the problems and hopefully providing some solutions, but it's up to the VA, maybe after 10 years, to finally implement some of those. The latest thing I see in your report is an incident from March 2013 in which sensitive private, perhaps medical and personal data was transmitted over an unencrypted telecommunications carrier network. Can you tell me what happened when that personal data was transmitted unencrypted? Apparently, VA did not know they were doing that. What's their response? You indicate that the management acknowledged this practice and formally accepted the security risk. Did they identify who was at risk, how they were at risk, and did they close this security gap?
That's your report. You want to?
Yeah, we received a hotline complaint discussing the transmission of unencrypted data between the medical centers and the community-based outpatient clinics using unencrypted protocols over a telecommunication carrier network. And we went and discussed with the network engineers and various levels with VA, and they admitted that this is a common practice. This is how PA.
No, this is a
transmitter.
common practice.
It's a common practice, but a mitigating factor is they logically segment that traffic from other customer traffic. The downside of that is it still needs to be encrypted, and there are technological solutions that can encrypt that traffic when it's outside of VA's span of control. Now, VA responded to that report by saying they plan to implement encryption controls, so that will improve that risk of losing that data as it leaves VA's span of control.
And sorry, Mr. Chairman, one last question. So they plan, do you know if they actually have implemented the encryption to protect
My
sensitive
understanding
data?
is the edge router encryption controls have not been implemented yet.
Well, I yield back, Mr. Chairman.
Ms. Walorski for 5 minutes.
Thank you, Mr. Chairman. I appreciate the report. I appreciate the information. I will tell you, when I was in the Indiana House, we did hold companies responsible for these massive breaches of identity theft, especially when a Social Security number was in the breach. And so we did have legislation, and we still do, and I think 17 or 18 other states now have it as well, holding private companies responsible. And if they're